Hi, everybody. This is Norm DeVay, and I'm the Vice President of Marketing here at Copa Health. And yes, this is the Copa Roundup for Friday, October 15th. I love Fridays. I love October because it's cooler out. I actually took the top off my Jeep last week, and I've been driving around with the top down. And believe it or not, I've had to wear a jacket in the morning because it's so cool here in the Phoenix area. So that's actually exciting, though. Football, Halloween's coming up, Thanksgiving, the holidays. It's just such an exciting time. The fall has always been my favorite season. So, hey, today we are going to be celebrating medical assistants. We're going to be doing a recognition for medical assistants because next week is Medical Assistants Recognition Week. And in order to do that, we've got the person who is in charge of all of our primary care here at Copa Health, Dr. Shaun Dekutoski. And Shaun really knows a lot about the fall because she spent time in Michigan and Minnesota. So we're so glad to have her here. Dr. Dekutoski, how are you doing today?
I'm well, thanks. Although I'm missing out on like cider and hot cinnamon donuts, at the cider mill in Michigan. So that I might have to drive to Sedona to get something close to that, but I'm doing well, thanks.
Yeah, that is heartbreaking to me because, it's one of those things where I always try to make the time in Phoenix as fall-like as possible, but it just never quite gets there. But I think maybe I'll do a Zoom background. So I've got little ghouls and goblins and then Thanksgiving turkeys and stuff behind me. But, you are such a regular on the Copa Roundup that sometimes I think if ever, I am hit by a bus or I have an extended illness, maybe you could step in and fill in for me. But now, before we get going, before we start about the medical assistants and the recognition of them, I just wanted to make sure that you're doing okay. I know that you are a staunch advocate for getting the COVID-19 vaccination. And I just want to make sure that you're doing okay, that you think the message is getting out there all right.
Yeah, we're continuing. It's again, a daily and weekly and monthly effort to make sure everyone's has access to the vaccine that is interested in getting it and answering questions people have that have made them less certain about getting vaccinated. So for both our members and staff, that's an ongoing passion of mine, is to help protect the health and safety of everyone. So we're looking at, again, other unique ways to help make sure we're sharing that message with all of our members and not leaving anyone out of that option to protect themselves and those around them. So yes.
So Dr. Dekutoski, medical assistants. Tell me exactly, tell me in general terms what a medical assistant does. I'm guessing it's not like a resident assistant in college or a teaching assistant in college. I think it has more to do with the profession.
Right. Well, medical assistants do complete a program to get certified. And the programs can last anywhere from like 9 months to even a couple years, depending on the specifics of the program. And they really work hand in hand with other medical professionals. So in the primary care area, we really think of our medical assistants as being an essential part of our team. So much of what they do is they're the first connection to our members as far as in the PCP area, whether it's starting from scheduling their visit, finding out what their concerns are, checking their vital signs, rooming them so they can be seen for a physical exam, drawing labs, or collecting lab samples, or also running some labs and EKGs on site. So they really are the members' first touch point with getting in to see their provider. And I know on the behavioral health side, they also do so much behind the scenes to, again, help with that communication, whether it's about appointments, whether it's getting medications that need special authorization approved by insurances, or communicating member concerns to the provider, that they just have a very essential role in connecting the members to their care team to kind of complete the circle between the case manager, the provider, the primary care provider, as well as the behavioral health provider, and just really kind of completing that circle.
So I know when I go in to see my doctor, often somebody will come in and they'll set me down and take my blood pressure and my temperature and check my oxygen levels, like say blood ox or something. It's just they put this thing on my finger. I can assume that they might be a medical assistant then, right?
Usually that's the case. Mhm.
Okay, but they do so much more here at Copa Health, as you mentioned, with integrated care, especially when you're talking about primary care, behavioral health, whether it's serious mental illness or maybe substance use or something. The importance between communication between the caregivers that are seeing somebody for their mental health condition and the care that they're getting from you and doctors like you for primary care is so important. So a medical assistant, I imagine, is very important in making sure that all that information is, transferred and correct, right?
Right. A lot of the time our case managers will communicate directly with the medical assistants concerns that they've either become aware of or noticed in conversations or visits with a member, or also relaying messages from the member themselves, so that then it can be kind of connected to the right spot and the right time, as far as knowing, oh, is this something that should require a visit? Is this something that needs urgent attention by the provider to determine the next step in addressing their concern, and that sort of thing. And in addition, the medical assistants have been extremely pivotal in their role for helping with just some of our health measures. We've heard about the TIP screens and other things for screening for diabetes and some of the other quality of care measures, and the medical assistants have been so active in that, whether it was contacting members to get them in for labs that they were overdue for, or actually doing so many of the lab draws on our campuses. So they were very helpful with that project, which also helps monitor the health of our members.
It sounds like such an important feature. I know that a lot of medical assistants go on to become registered nurses, or some even go on to become, medical professionals even beyond that. But, I know that for the next week, I'm not going to be going in to see my doctor. And actually, fingers crossed, I'm not going to be going in to see a doctor because, unless something happens, I get sick or I'm in an accident or something. But how can we go about recognizing medical assistants during Medical Assistants Recognition Week, and saying thank you for all the hard work that you do? I know here at Copa, I may be able to reach out and actually say to some of them personally, thank you so much. But what would you like people to know about how they might be able to thank medical assistants?
I still think one of the nicest ways to honor the people we work with, other than winning the lottery and sharing the winnings, is just those direct compliments. And I think we sometimes forget the importance of a kind word, especially when it's genuinely meant, and especially the more specific can be. We know that our medical assistants are always multitasking. They're answering phones, they're faxing, they're running between members and other staff. They're doing procedures. They're doing so many different tasks all at once. But I think sometimes when it's the little things that matter, and when we can in genuine ways acknowledge what some of those things were that made a difference. When it's something specific, hey, when you saw this member, you really helped put their mind at ease because you addressed their concern right away and got them in for that appointment. Or again, thank you for just having that calm manner that is so helpful. Or I appreciate your sense of humor every day. Or thank you for getting through a busy day when we were all felt like we were scrambling and making it go well. But I think sometimes the specific things that acknowledge, especially sometimes in challenging situations, but even when it's a good day as usual, to acknowledge that and say, gosh, you were part of today that made today go so well, is that you were so effective at communicating today, or I appreciated how you handled several of these urgent tasks and made it look easy. But I think sometimes those kind words, and the more specific we can be with our compliments, I think that means a lot to people. And again, is something that renews each of us when we feel like we don't do our work to be acknowledged, but when we are, it can be something that just kind of rejuvenates us and refreshes us to continue doing good work and providing good care because someone noticed. And then it makes us realize we made a difference for that member today. We made a difference for that staff today when they were, whether it was a good day or a rough day for them. And so I think acknowledging that they are an essential part of our team, that they are medical professionals that we admire, and that they are medical professionals that are essential in COPA, in our outpatient clinics. So I think those would be my suggestions on ways to make them realize that we notice and that we appreciate all they do and continue to do for us and for our members.
Yeah, I think that is a great answer. So I think I've got a couple things I'm going to do this week. Number one, I'm going to work with my friend and marketing director, Linda Torkelson, and we're going to get a couple messages out. If I see any of the folks out at the clinics that are medical assistants, I'm going to specifically thank them. And I think I'm going to go buy some lottery tickets because you never know. And if that happens, then I'm going to be able to, follow your lead and make their weeks and lives just a little bit better. But, I really appreciate you being on with us again today, Dr. Dekutoski. You're, other than, I know we're going into the fall, we're into the fall and we're going to be heading into the winter season. There's a lot of people who are, still worried about COVID, but what would you tell people about, other than COVID? I mean, I got a flu shot last week. I'm here at Copa Health. Are there other things that you think people should be doing to make sure that they're staying safe? And are there things that you're doing to make sure that you and your loved ones are staying safe, not just during COVID, but during the beginning of flu season?
Yeah, well, definitely we encourage flu vaccination for all of our members and all of our staff. The flu is miserable to get. You can be in bed for a week with a high fever and feel lousy. So it's just such a simple vaccine to get, and it's available pretty much everywhere right now. We also have HR has been working to have it available at I believe 9 different sites and different times at our outpatient clinics and our ERS site, et cetera, to just try to, again, make it one step easier for people. So definitely that we recommend. And if someone's getting a COVID vaccination, it can be given the same time as a flu vaccine. You can get them both on the same day. So if you hadn't had a COVID vaccine and you decide to get both at once, they can be given at the same time. But also just take care of yourself. So the things we always want to practice what we preach, try to get regular sleep, try to get regular exercise, try to pay attention to what we eat and eat more things that look like they came directly from the farm and aren't pre-processed. So again, fruits, vegetables, and healthy proteins and all those things. We need to take care of ourselves too in order to do our jobs most effectively and to also feel gratified in our jobs if we're not running on empty. So just taking that time to when we're away from our work to do something we enjoy that's important to us, and then to take care of our bodies so that we stay healthy too.
Yeah, I think that is a great answer. I actually, my wife started us on a no added sugar diet starting August 1st. We still have sugar that occurs naturally in fruits and things, but we avoid anything that has added sugar. And I know Michelle Spear, who's our wellness coach, always says, good job for that. And by the way, Michelle is going to be having a new health challenge coming up starting October 25th. So everybody try to find out more about that. Go to CopaNet if you can, because we've got all kinds of information out there. Take Dr. Dekutoski's advice and, try to, stay as healthy as possible and live a healthy life, and especially during periods like we have right now with COVID-19 and the flu happening all at the same time. Colds are the things that always hit me. When I get a cold, it just seems to last, 3 or 4 days longer than it should. So I'm doing my best to try to take care of myself and the people around me. But everybody, until next week, try to stay healthy, like Dr. Dekutoski said. And if you get an opportunity, go out and get your COVID-19 vaccination. Get your flu vaccination. We are taking care of not just our own health, but the health of others when we get vaccinated. It's such an important thing that you try not to get other people sick by getting yourself sick and being around them. So we will be back next week. I believe it is going to be October 22nd. Wow, October 22nd. I think that's the last week before the Halloween week is coming up. And I know that we're going to have some contests here at Copa Health for all of our employees for Halloween costumes and stuff. So I'm so looking forward to seeing how you all dress up. I wish I could dress up as the Mandalorian. I just don't think I could fit his little metal outfit on me. So, but until next week, everybody, Dr. Dekutoski, thank you so much.
Thank you. My pleasure. Thank you.
Yes, and we will see you all next week, October 22nd on the Copa Roundup. Take care.